Good morning and welcome to today's compliance webinar. We're going to be talking about COVID-19, COBRA subsidies, vaccines, extended benefits, and leave requirements. Before we get started, just a couple of housekeeping items. So this presentation is not legal advice. I repeat, this is not legal advice. If you have specific legal questions, please refer to your own legal counsel. You are listening today as a participant, but we do want to hear from you. So please submit your questions for our compliance team using the Q&A button on your Zoom screen. We are recording and we will distribute a copy of the recording along with the slide deck, as well as information on how you can claim your HRCI and SHRM credits in a follow-up email that will go out tomorrow morning at about 8 a.m. So look for that tomorrow. And for today's session, this is a snapshot of what we're going to be covering, as well as a roadmap of the specific topic, so you can follow along as we go. And without further ado, I want to introduce you to Joanna Castillo, who's going to talk about group health plans. Joanna?
Hi, everyone. Thanks, Camille, for kicking us off. Welcome. We are so happy to have you here today. We have an extremely ambitious agenda, so I want to hop right in to our next slide and show you this very beautiful COVID-19 legislation timeline. There has been so much that has occurred over the past year, so many bills coming out of Congress, so much agency guidance, not to mention state and local laws that have come out. We've just all been dealing with so much change, and there's been a lot to learn. So that's the reason why we're really holding this webinar today. We want to make sure that you all understand sort of what's still top of mind, what items are still ongoing, and what your action items are. So again, very ambitious. We're going to try to get through it all. But I want to start out with this beautiful timeline. So tons of timelines you're going to see in our presentation today. But this is really a summary of the major group health plan changes that occurred really a long time ago, kind of at the beginning of the pandemic. So just kind of a good reminder of what happened. So way back in March of 2020, the IRS basically set out some guidance that said, you know what, don't worry if you enrolled in a high deductible health plan. We realize we're in a pandemic. We're going to allow both COVID testing and treatment to be pre-deductible for you. And that guidance is still ongoing, so it hasn't ended, it's still being allowed. About a week later, we had the FFCRA come out. I'm sure many of you remember that one because there was so much involved in it. But the really big thing that legislation did for group health plans was it waived the out-of-pocket costs for COVID testing and the associated visit. And this is what was a required change for group health plans. And then at the end of March, so just so much happening in March of last year amidst the pandemic, we had the CARES Act come out. And there were two major things that did for group health plans. So first of all, for high deductible health plans, it really allowed all telehealth services to be provided with no cost sharing before the deductible. So, you know, that was pretty major. That actually is set to end at the end of this year right now. But I do think that there's a very good chance that is going to be extended. So to be determined there. And this was an optional thing that high deductible health plans could adopt. And then finally, we had some legislation here in the CARES Act that basically said, you know what, for non-grandfather group health plans, which is really most group health plans these days, you know, those plans have to provide the approved vaccines with no cost sharing. So basically free vaccines. And that included high deductible health plans. And this was a required change. So what does that mean for employers? Sort of moving on to your action items here. So if you are a fully insured employer, you really should not have any action item. And I want to call out that we have fully insured employers on the call, self-insured employers on the call today. We're going to be trying to really call out your action items separately so you understand what you need to still consider. And I also know we have a lot of employers here on our PEO, on our Sequoia One PEO. So we definitely want to make sure we're doing special call outs for all of you as well. So at the end of each section that we present today, we're going to be saying, you know, Sequoia One PEO employers, here's what, you know, the PEO has done, and here's what you still need to consider. And the reason being, the PEO really acts as plan sponsor. So you're going to find the PEO oftentimes kind of takes care of the action for you, and we don't want you to be confused. So look for those call outs at the end of each section. But for fully insured employers here, really no action. Carriers should be updating your documents. If you're a self-insured employer, you do have some action here. You want to make sure that your third-party administrator is helping you to update your plans to reflect these required health plan changes or anything that you've adopted. So make sure you're having that discussion with your TPA. I'm seeing a lot of TPAs reaching out right now about this. And then finally, for the PEO, again, we adopted all of the changes. All of these things are available for our PEO worksite employees on the Sequoia One plans. I'm going to kick things over to Emerald. She's going to talk about something a little trickier than this last section. So extended deadlines and then how those deadlines are going to be ending. So over to you, Emerald.
Thanks, Joanna. Yeah, so I'm going to be talking through some required COVID deadline extensions. And really what happened is back in April 2020, the IRS, DOL, and Treasury released this notice extending certain employer and plan participant deadlines during something that's called the outbreak period. And the outbreak period is really something they made up for purposes of this rule. And it started back in March 1st, 2020, and it ends 60 days after the end of the national emergency. So what happens is applicable deadlines, which we'll go over in the next couple slides, are paused during the outbreak period, and then they become unpaused after the end of the outbreak period. So right now, we don't know when the end of the outbreak period is because there hasn't been an announced end to the national emergency. So these deadline extensions are still ongoing. A couple months ago, we did get more guidance from the agencies, and the agency said, basically, we understand we only have the power to extend deadlines up to 1 year. So the longest a deadline extension can go is 1 year after an individual's original deadline. So why are we still talking about this? As I mentioned, these deadline extensions are still ongoing. So employers, you do have responsibility here. You do have to allow participants additional time for certain rights. So let's get into what relief is provided for employers. So employers during this time have an extended deadline to furnish required ERISA notices. So that does include your summary plan description, summary annual report, COBRA notices, etc., as long as the employer acts in good faith and has provided them as soon as reasonably practicable. A second thing it does is it provides employers the ability to furnish these documents electronically, so through text, email, a continuous access website, as long as they reasonably believe plan participants have access to that medium. Okay, so moving on to the extensions for plan participant deadline extensions. So under this rule, plan participants have additional time to request HIPAA special enrollment rights, elect COBRA coverage, pay COBRA premiums, and file and appeal benefit claims. So how would this work? So for HIPAA special enrollment rights, generally employees have at least 30 days from the time they lose coverage under another group health plan or obtain a new spouse or dependent through marriage, birth, or adoption to request that special enrollment. So if that 30 days falls within this outbreak period, it's paused and unpauses at the end of the outbreak period. So they basically have 30 days after the end of the outbreak period to request that special enrollment right. Again, we don't know the end of the outbreak period yet, so they would basically have up to 1 year from their original deadline. So same thing here for electing COBRA coverage and paying COBRA premiums and filing and appealing benefit claims. And for the last one here, we really see this apply mostly to FSA run-out periods. So that's the time after the end of the plan year. And employees have to submit claims for their FSA, so that deadline is extended as well. So let's move on to an example. I think this would clear things up. So assume that you have an employee, his name is Alex. He was terminated June 10th, 2020. He's provided his COBRA election notice June 30th, 2020. So under the normal rules, he would have 60 days after he's provided that election notice to elect COBRA. But because we know this deadline falls within this outbreak period, his time is extended to elect COBRA. So we would have up until August 30th, 2021, so 1 year after his original deadline to do that election. If the outbreak period ended before then, he would just basically have 60 days after the end of the outbreak period tacked on to elect. And then one thing to point out here, if Alex does elect COBRA, he will have to pay retro premiums back to July 1st, 2020. So what does this mean for employers? Really, they should be working with their COBRA vendor to see how these extensions are being implemented, right? So plan participants, COBRA qualified beneficiaries should be notified of their additional time to elect COBRA, should be notified of their additional time to pay premiums. And really, you should be working with your vendor to see how these extensions, especially for the premium payments, are being implemented. Another thing, we do recommend you notify your employees and amend plan documents, and we do have templates for that. For these HIPAA special enrollment rights, you should really be cautious when denying special HIPAA enrollment rights, making sure you provide that extra time for employees. And then if you do have an FSA runout period, work with your vendor to notify employees of their additional time and check to see if they did make amendments to the plan.
Hey, Emerald,
yeah.
I just wanted to pop in with a question here. So I'm curious, you kind of showed a graph about, COBRA and how that would work when somebody has more time. Is that the case? Can you kind of talk about how that works when you're dealing with maybe like a HIPAA special enrollment, or how do those timelines change? Is it always the same?
Yeah, that's a great question. So the concept is the same, that the deadlines are paused during the outbreak period up to 1 year and then unpaused at the end of the outbreak period. But they all pretty much run on their special timeline. So with HIPAA special enrollment rights, that's 30 days. COBRA elections, that's 60 days. And then the thing that's special about HIPAA special enrollment rights is that you can elect prospectively. You don't necessarily have to do retroactive like for COBRA elections. But yeah, great question.
Yeah, thank you.
Yeah, so I'm going to hand it off to Lizette to talk through how Sequoia One is actually handling these deadline extensions.
Awesome, thanks, Emerald. So long story short, for our clients out there, you don't have any action items with respect to complying with these outbreak period extensions. Sequoia One, as the PEO plan sponsor, does have the responsibility to, comply with these and make them work throughout the outbreak period. And we're also responsible for completing all of the necessary amendments and working with the COBRA and FSA vendor to make sure that your worksite employees get notified of any looming deadlines and just keeping them updated. So with that, I'm going to pass it off to Joanna to continue the conversation on COBRA subsidies, since that's really top of mind for a lot of us right now. So hopefully we can get some clarity.
Okay, thank you so much, Lizette. Yeah, I kind of think of this as the main event here, really. ARPA really, it came out about 1 month ago only. It seems like such a long time ago now, but it was just 1 month ago. And if I can say anything, I've been getting some questions about, how much do I need to worry about this? Is this something that's optional? Do I need to consider all these things? These subsidies are required if they apply to you. So it's not something that you want to kind of brush off. There can be major penalties surrounding COBRA. So definitely something you want to look at, want to work with your COBRA vendor on, not something to kind of brush off. So I'm going to start today talking about how subsidies work. So certain assistance eligible individuals, and I'm going to be referring to these people as AEIs throughout our conversation today. We love our acronyms in this industry, but AEIs can basically receive free COBRA. They can do that though only if they actually enroll. And the COBRA is only going to be free during this 6-month time period. So that time period is from April 1st, 2021. So notice we're already in that time period through September 30th of 2021. These subsidies only apply, as far as we know right now, at least, to medical, dental, and vision coverage. It also is going to apply to health reimbursement arrangements. We know that the subsidies do not apply to FSAs. Something else I think is really important about the subsidies is that the subsidies do not extend the maximum COBRA coverage period. So most people generally get 18 months of COBRA coverage. That's the most that you have. These subsidies don't give you any more time than that. So if your 18 months happens to fall within this 6-month period, you might be eligible for a subsidy if you are an AEI. And then sort of the last thing here that the ARPA does is it creates what's known as a special election window for certain AEIs to basically hop onto COBRA now, if as long as they're still within their 18-month coverage period. So I'm going to explain a little bit more about how that works, but kind of a tricky situation there. And then before I move on to who is an AEI, I just wanted to briefly state, most people care about like who's going to be paying these subsidies and who's going to be receiving the money back from the government. So it's good to know that employers really are going to be on the hook for fronting this money. So employers who are subject to federal COBRA, that generally is going to be employers that had 20 or more employees in the previous calendar year. This is also going to apply to all self-insured and level funded employers. So anybody on the line who is a Sequoia Scale program client would also be subject to this. So basically, you'll front the money as the employer. You'll be able to have that money reimbursed by the federal government. In addition, insurers are going to be on the hook for some of this. So for any state-like COBRA laws, so you want to think about small employers that are under 20, they might be only doing state COBRA. The insurance carrier in that situation is actually going to be responsible for paying out these subsidies and then getting that reimbursement from the government. And then quickly just wanted to mention for our PEO, the PEO is the plan sponsor on those PEO plans. So they're actually going to have some responsibility as the PEO, which we're going to talk a little bit about at the end of this section here. So who is eligible? Who's an AEI? Let's talk a bit about that. So first of all, an AEI is going to be a COBRA qualified beneficiary. And that could mean your employees, former employees, their spouse or dependents who were covered by the plan on the day they had a qualifying event. Now, here's a really important part about an AEI. So you're only an AEI if you lost or lose coverage due to either a reduction in hours or an involuntary termination. So that is really what sets apart an AEI from just a normal COBRA qualified beneficiary. Now, AEIs are going to include those who are maybe already enrolled on COBRA and are going to have their COBRA period extending, through this April 1st date. It could also be somebody who is going to enroll in COBRA during the subsidy period. Here's kind of the tricky part. So AEIs who never enrolled in COBRA. So maybe they had an event way back when, decided coverage was too expensive. Maybe they forgot to enroll. It really doesn't matter here. As long as they were an AEI, they're potentially going to have the opportunity to hop back into COBRA. That also includes people who maybe elected COBRA for like a short period. So 3 months and then dropped it. Those people are going to have an opportunity to hop back on. Now, I think this is what causes a lot of confusion for employers. So this includes qualifying events that are going back all the way to October of 2019. Okay, so that is, quite a long time ago. And the reason you have to think back that far is because if you think about it, somebody could have had a qualifying event, maybe they were terminated in mid-October. That means their COBRA period would have started November 1st of 2019. So if you count forward 18 months from that, they actually are still in their COBRA window, and that is actually going through until April. So that means this person who maybe had an event way back in October of 2019, they might have the opportunity to hop on and get free COBRA for like 1 month. So that's why this October 2019 kind of date keeps coming up. We also know some people are not going to be eligible for these subsidies. So I wanted to point that out as well. So first of all, non-spouse domestic partners are not eligible for subsidies. That might sound really strange to you if you're an employer, because most employers do allow a COBRA-like coverage for domestic partners, but domestic partners have actually never been federally recognized. So that's why they're just not eligible for this federal subsidy. Number two here, really important, people that are eligible for other group health plan coverage or Medicare. So, think about somebody that had a new job and they have access to coverage, or maybe they even have access to coverage through a spouse's plan. Those people are not going to be eligible for subsidies. And you're going to see when you look at these DOL model notices that just came out, when somebody goes to elect, they have to verify that they're an AEI, so that they had one of these, either a reduction in hours or an involuntary termination. And they also have to verify that they do not have access to other group health plan coverage. And even right there in the notice, it explains that those folks could be subject to a penalty if they elect a subsidy and they were not eligible. And then finally here, probably obvious, but voluntary terminations are not going to be eligible for a subsidy. And I think it's really important to state right here that we actually do not have great, or if any, guidance from the DOL right now about what is an involuntary termination versus a voluntary termination. So you might have some gray area situations that you're not sure about. Definitely want to kind of mark those down, look back at those, maybe act in a more conservative manner when sending out notices. I would take a more broad approach when doing that if you're unclear, because we're still waiting on that guidance from the DOL, which is expected. We think they are going to kind of give us some information about that. Okay, so let's say I'm an AEI, right? How in the world do I know that I can elect these COBRA subsidies? That's really, really important, right? And you as employers, if this is applicable to you, you're going to have the obligation of sending out COBRA notices to these groups of folks. So the way I've really thought about this, I looked through all the notices that came out pretty recently, and I've really coupled these notices into 3 different groups. Okay, so the first group you're going to want to think about is people that are already COBRA enrolled, or those who enroll, or those who were eligible to enroll in COBRA already. So as long as they're still within their maximum 18 months, so again, going back to October of 2019, this is group 1, that's who you're thinking about. You've got 2 notices that you need to send to these individuals, and you gotta do it by May 31st. Okay, so you have about a little over a month to get this done right now. And then from the time people receive the notice, they're gonna have 60 days to elect into that coverage. So very, very important that you are working with your COBRA vendor right now so that these notices get out on time. And then the second group here is those folks that become eligible for COBRA during that subsidy period. And for those people, the COBRA timing is going to be the same as usual. So you normally have 44 days to get people a notice, and that's still the case here. So somebody that has an event happen on or after April 1st, you've got 44 days to get them these notices, and they're also going to have 60 days to elect. The main kind of issue here is that you're going to see the 2 notices that you need to send to this group. There's a little bit of a differentiation between the notice requirements here. So I've linked them here. So hopefully, after the presentation, you can go back and take a look and make sure your COBRA vendor's on top of that. And then we've got a third group here. So you need to send notices as well when the COBRA subsidy is going to be expiring. So we know the subsidies are going to expire for everyone at the end of September. So they're just going to be done at that point. So you have 15 to 45 days before that end of September date to get these subsidy expiration notices out. I think what's also important to note, though, is that you could have some people losing subsidies prior to that September 30th date. So if their 18 months is running out, let's say at the end of July, you actually need to get them this subsidy expiration notice 15 to 45 days before that end of July date. So this is going to require some tracking and some work definitely by the COBRA vendor And you just want to make sure they're on top of it, because at the end of the day, they are helping you with this, but the obligation is still on you as the employer. So moving on now, I thought,
Hey, Joanna, just
yeah.
before we move on, I have a quick question that I think might be relevant. I know Emerald just went through all those deadline extensions during the outbreak period. So how does that interact with the deadlines that you just talked about specific to, the ARPA COBRA subsidy?
Yeah, that's a really, really good question, actually.
It's a fun one.
Yes, it makes it really complicated if you're trying to think about the COBRA deadline extensions with now these new dates. So the way to think about it is those COBRA deadline extensions that Emerald was talking about, they do not apply to these ARPA COBRA subsidies. So you have, these are the deadlines that the notices need to go out by. So May 31st, or you have 45 days, and people only have 60 days to elect in. So those earlier deadlines where we said, people have a year to figure it out, not the case for the subsidies. So if somebody wants a subsidy, they're going to have 60 days from the date they receive notice to elect. So that's super, super important. Thanks for the question. Really, really good one. Okay, so I want to talk a little bit, I've been talking a lot about notices. So you're going to see when you pull up these model notices that the DOL came out with about these subsidies, there's some tailoring involved in those notices. So you might have to put in some plan information, things like that. And part of this tailoring has to do with this COBRA election change option. So this is something new that's not normally allowed for COBRA, but in ARPA, it basically said, you can allow these employees to elect subsidies, and when they elect, you could allow them to switch to an equal cost or lower cost plan. Normally, when you're on COBRA, you just get the plan you were on the day you had a qualifying event, and that's how it normally works. For this, there's a little bit of an allowance that employers could do, but keep in mind this is optional. If you're going to allow it, you need to make sure that's listed in the model notice. You'll see there's a section specifically for this. People need to know about it if you're allowing it. I would say as a kind of an aside, I'm not seeing many employers adopting this special sort of election change. And that's really because there's just already so much complexity that employers are like, I don't want to do this. It's too much. But I just did want to point it out that it is something you could allow. All right, so on to the next here. I thought it would be helpful to show another timeline. You're going to see a lot of timelines today. But this is an example of how the AEI election window would work. So let's say you had an employee who had an involuntary termination way back in September of 2020. Okay, so we know they look like an AEI because they had an involuntary term. And they probably had coverage last them through the end of September, meaning their COBRA 18-month period would have started October 1st. So if you count 18 months from October 1st, you're looking all the way forward through the end of March of 2022, actually. So way into the future here. Let's say this person just never elected. They were like, you know what, this is expensive. I don't want to elect. Maybe they just didn't do it. It really doesn't even matter here. They're going to have an opportunity to hop back into COBRA. So right now you're getting the notice ready. You're going to send it to them. Once they receive it, they're going to have 60 days to elect into coverage. And their coverage can be free during this entire 6-month period here. And we can see that because their 18 months goes beyond September. If this person's 18 months ended earlier than September, they would have the subsidy just up until that 18-month time period. When this person goes to elect, kind of the interesting thing here, because we're already in the subsidy period, this person can elect coverage back to April 1st, actually. So it doesn't matter that they're electing possibly in June or maybe even July at this point. They can have coverage going all the way back to April 1st, and it can be free during that 6 months. So I thought it would be interesting to just kind of show an example of how that works. I think it's also important to point out, in terms of kind of Lizette's question earlier about these deadline extensions, you might be kind of asking yourself right now, like, how does this work? Because we told people they had, maybe up to a year to elect COBRA. could this person potentially elect going back to that October 1st, 2020 date? And the answer is yes, they actually could do that. So because of that deadline extension, when they go to elect COBRA, they can still hop onto COBRA coverage all the way back to October 1st. The kicker here is they have to pay premiums during that time period, right? This person would have to pay premiums from October 1st all the way through until April 1st. Then they would have free coverage from April through September. And then they could actually continue their coverage on if they wanted to pay for it post that September 30th date. So that's how it would work when we're talking about those deadline extensions. I know it's very, very tricky, but it really just depends on, those extensions can apply, but only if people are going to be paying for premiums outside of this like subsidy window that we have. Okay, I hope that visual helped, but as I stated, we actually still have some big questions remaining about these subsidies. I'm very happy we have model notices now. That's great considering we got to get those out the door. But first of all, again, involuntary termination, we don't know exactly what that means. So if you have some gray area, I would just act on the more conservative side. Number two, I'm getting lots of questions about severance agreements. And this is a very smart thing to be asking questions about. If you have severance agreements that are going to be running during this subsidy period, you absolutely want to take a look at those agreements with your employment counsel who help you draft those, because you may need to update that language. If you think about it, usually you're stating that people are giving up rights because you're paying for coverage for them. Well, the truth is during this 6-month period, you're not paying anything. The government is actually paying for that coverage. So you may need to tweak that language. You may also want to consider starting your severance after the subsidy period for people who are AEIs or who elect. And that means you would need to update that language as well. Number three, this is a big one. We don't have instructions for how to apply for these tax credits. What we do know is that employers are going to be basically offsetting your quarterly Medicare tax. So the amounts that you're paying for COBRA, you're going to offset it against that tax you would normally pay on a quarterly basis. And then if that COBRA amount goes above and beyond what you would normally owe in Medicare tax, you're going to be receiving that as a reimbursement from the government. But yeah, we don't have a step-by-step on that yet. So TBD, I'm really hoping we get that information soon. And then finally, we're sort of missing guidance for our PEO, our Sequoia One PEO. We kind of have an idea of how this is going to work. And I'm going to kind of kick things over to Lizette quickly to explain sort of what we know so far and how this is going to affect our PEO clients. So Lizette.
Yes, thanks. Thanks, Joanna. So since the PEO industry is really eagerly awaiting the specific guidance from the DOL, I just want to give our clients out there a heads up that if, we'll be sure to communicate with you if there are any specific action items for you to take, that may need your attention. But for now, based on what we know so far, the PEO, with the help of our COBRA vendor, is going to be generally responsible for providing the model notices to those 3 different groups of former employees that Joanna went over. And also, again, for fronting the subsidy for any of those verified AEIs. So what that means for all of our clients out there is that the PEO will be the entity that's fronting and also claiming the subsidy reimbursement from the government. That said, I do want to do a special note, just giving clients out there a heads up that there may be instances with the PEO will need to reach out to you with respect to determining, when a termination was involuntary or voluntary. But in those instances, you'll get a communication from us and directly working with our team to sort of verify that AE status. All right, and then back to you, Joanna.
Thank you, Lizette. And Camille, I don't know if would you mind going back a slide really quick? I just wanted to point out, we do have this really awesome COBRA COBRA, ARPA, subsidy, FAQ that our team has put together. We are constantly updating this as more guidance has come out, and this is available to all of our clients through Sequoia HRX. So I just wanted to point this out. We've also been highlighting it in our compliance newsletters that we've been sending out. It is geared towards our Sequoia consulting group side because those employers have a little bit more action, but just want you all to know that this is available for you. And then moving forward to my wrap up here, this is really our kind of recommended employer action to take. So number one, you want to review and update model notices with your COBRA vendor. Number two, you want to connect with your COBRA vendor. This is so important because you guys are working pretty closely on this together. You want to understand what their process is. You want to make sure you understand your role and any decisions or action items that you have with that vendor. Number three, you want to make sure your vendor's sending out timely notices to those relevant 3 groups that I talked about and that they're tracking that. Number four, you may need to review and verify AEI elections. So somebody could elect, maybe you disagree that they're an AEI. That might be something that your COBRA vendor wouldn't otherwise know, and they may need you to kind of tell them one way or another. And then finally, and maybe most importantly, it's so important that you track the subsidy amounts that you're paying as an employer. You want to have really good record keeping of that so that when you go to offset it against your quarterly tax, you have all of those amounts and it's being tracked really well. So that's my wrap up here. I know we're waiting on more guidance, but I'm gonna, hopefully we'll be sending you more information as these things come out, and look out for some direct emails from us. So I'm gonna kick it over to my colleague Emerald now. She's gonna talk about mid-year changes. There have been so many of those. So over to you, Emerald.
Yeah, thank you, Joanna. So I'm going to be going over some optional things employers can do for their group health plans, their FSAs, and their dependent care FSAs. So basically what happened for the last year, Congress has been passing a bunch of different legislation. The IRS has released a bunch of notices, and what they all do is they really provide exceptions to the normal rules surrounding pre-tax benefits. So these exceptions or this relief really falls into 3 different buckets. So first, there's temporary relief around the rules for mid-year election changes. So normally employees must experience a permitted change event or a qualified life event like a QLE to make a change to their elections mid-year. But under this relief, that's temporarily suspended. So the second change here is temporary relief for the use it or lose it rule and the maximum exclusion limit. So normally for dependent care FSAs, elections have to be used within the plan year, and unused amounts have to be forfeited back. So basically the IRS is giving employees additional time to use those funds. And then the third relief here is the IRS pretty much expanded the list of eligible items that can be reimbursed through these pre-tax vehicles. So through an FSA, through an HSA, etc. So why are we still talking about these, right? So employers really still have the options to adopt these changes, and I'll go over the menu of changes for the 2021 plan year. But it does require employer action. It does require plan amendments, and you should be checking with your carrier or your stop loss provider if you're self-insured, or your program vendor to make sure that these changes can actually be implemented. Okay, so jumping into mid-year election changes for group health plans, and I'm going to cover this briefly, but what this allows is mid-year changes for enrollments, changing existing elections, and revoking coverage. So for the 2021, we have not really seen a lot of carriers allow for this. But if you are self-insured and you do get approval by your stop loss provider, then you can still offer this for 2021. Okay, so on to the meat and potatoes of changes for FSAs. So for FSAs, if you go on to the next slide, Neil. For FSAs, you can also allow that prospective mid-year changes, even if that employee doesn't experience a permitted change event. So that can allow an employee to increase elections, decrease elections, or revoke coverage. Another thing employers can do is you can allow more time for employees to use those funds by implementing a carryover up to 100% of unused funds into the next plan year, or a grace period for up to 12 months. So under the normal rules, you're only allowed to carry over up to $500 or extended grace period up to 2.5 months. So really, they're just elongating the time that employees have access to those funds. Okay. One thing to really watch out here, though, is if an employee has unused funds available through a carryover or grace period in the next year, they will be ineligible to contribute and to receive contributions to an HSA.
Emerald, that was a big watch out, I think. So I wanted to address that. Are there anything, employers can do for people that are enrolling into those HDHP plans? Because I'm sure people are still doing that, and they might have a big carryover amount left over from their FSA if they're changing like plan types.
Yeah, that's a really great question. And the IRS actually did address this and provided employers with tools on how to design their FSA to preserve that HSA eligibility. So employers do have 3 options. So they can design their plans to basically automatically convert unused FSA funds into a limited purpose FSA, which is HSA compatible for those folks enrolling into an HDHP. A second option here is they can just allow employees to convert their FSA to limited purpose FSA, and they can allow third to for employees just to waive that carryover or grace period altogether. So a couple options for employers to preserve that HSA eligibility. Okay. So a couple more changes that are allowed is employers, you can allow terminated employees to have access to healthcare FSA funds. So usually after an employee is terminated or employee revokes coverage from an FSA, they basically lose access to those funds. You would basically be giving access back for the rest of the plan year. And then finally here, you can allow reimbursements for over-the-counter medicine, including menstrual products and COVID-19 PPE, effective back to January 1st, 2020. So basically this would allow employees to use their healthcare FSA to reimburse things like gloves, masks, sanitizing wipes, things like that. Okay. So finally, I wanted to move on to changes for dependent care FSA. So again, you can allow prospective mid-year changes to dependent care FSA elections, allow employees more time to use their dependent care funds. So implement that carryover of up to 100% of unused funds or that extended grace period for up to 12 months. Another thing you should watch out here is employees may actually need to pay taxes on those rolled over amounts. So employees should definitely be aware of that. The reason really being is because the IRS says you have up to $5,000 where you can exclude from gross income for this dependent care assistance that is employer provided. But say somebody has a rollover or a grace period, like say $3,000, and they elect the entire $5,000 in a subsequent calendar year, they spend all $8,000 within that calendar year. That $8,000 exceeds that $5,000 maximum exclusion limit, and they may have to pay those taxes on that additional $3,000. Okay. So Congress actually tried to fix this for calendar year 2020 by increasing the maximum exclusion limit to $10,500. So what this would allow is that employee to, any employee to carry over $5,000 from calendar year 2020 into 2021, have that employee elect the entire $5,000 for 2021, spend that entire $10,000 within 2021, and then that would be all tax-free because it's under this new $10,500 limit. Another thing that's allowed with this maximum exclusion increase is employers can increase the salary deduction to $10,500 for their plans. But another watch out I wanted to call out here is that this actually may cause your plan to fail non-discrimination testing.
Ooh, Emerald, that seems like a big deal. So I wanted to ask a question about that. You know, a lot of dependent care FSA plans do tend to fail, I think, non-discrimination testing sometimes, because I think those highly compensated employees tend to elect more. So I just was curious, is there anything employers can do to still maybe allow that 10,500 and maybe not fail NDT, or what do you suggest here?
Yeah, that's a really great question. So we know dependent care FSAs do fail non-discrimination testing a lot. So a couple options for employers is you can just increase the maximum salary deduction for your non-highly compensated employees to just avoid that issue altogether. Or another thing you can do is allow that maximum increase for everyone, do a mid-year non-discrimination test, see how those elections actually fall and whether it causes your plan to fail NDT, and then make corrective adjustments accordingly before the end of the plan year. But yeah, definitely good question.
Yeah, this seems like a kind of ripe for communication to employees about if you're allowing that 10,500.
Yeah, for sure.
Cool. Thank you.
So last thing I want to mention is that your dependent care FSA can also permit reimbursements for dependents who age out or turn 13 during the pandemic. Okay, so what do employers have to do? Again, all these changes are optional. First thing you should ask is really, do you want to allow any of these changes? Which changes do you want to allow? When are they going to be allowed? And then you should really check with your carrier, your stop loss provider, or your program vendor to make sure that the changes are going to be implemented or allowed the way you want them to. Second thing here, you should really work with your vendor to amend those plan documents. That is required, but the IRS has given you extra time. So pretty much for changes for the 2021 plan year, you have until December 31st, 2022. So a bunch of time to make those amendments. Third, you should communicate these changes to your employees so they can take advantage of them. And we have a couple of templates that you can use to do that. And then finally, I think this is pretty obvious, but make salary deductions changes according to the new election changes. So I'm going to pass it over to Lizette to talk about how Sequoia One has handled these changes.
Awesome, thank you, Emerald. So as Emerald explained, there are many options for plan sponsors to untangle and figure out here, and really determine how to fit some of this COVID relief into our existing plan design and administration. So this is especially true for the Sequoia One program that's on a non-calendar year plan. So there are some special considerations there. But luckily for our clients out there, you have no action items to worry about because Sequoia One, as a plan sponsor, again, is responsible for determining what to adopt, making any necessary plan amendments, and also partnering with our vendors to communicate any of those changes out when they become effective. All right, so what I want to do is switch gears a little bit and discuss some COVID-related leave laws and cover important updates for you all out there. So first, what I want to do is set the stage here with this slide. And just to say that employers can really benefit by appreciating that there are often several layers of requirements that come into play all at once in terms of, deciphering whether paid or protected leave is available for your employees due to COVID-19. So how I like to think about it, I think about it in layers. And first and foremost, we always check federal law. So is there anything out there that may apply to these COVID-19 leave requests? And luckily, perhaps one of the most recognizable pieces of legislation recently is FFCRA. It is now voluntary and optional, so I'll cover that in a bit. But I also wanted to highlight that there's oftentimes state laws. Some of these states have been really active lately in passing temporary emergency supplemental sick leave frameworks that essentially mirror a lot of those qualifying reasons that we had seen in the FFCRA. And these are often designed to be in addition to any existing leave frameworks that you already have, or even your employer policies and any leave that's available there. Next, the next level we look to are whether there's any local leave that may be available for this, for COVID-19 reasons. So we have seen some cities and localities be pretty active in this regard, especially in California. There has been quite the patchwork that employers really have to be cognizant of. And then lastly, you can't really forget about your own employer policies that may cover some of this COVID-related leave that should be made available for your employees. So on the next slide, I want to begin talking about some really important updates that we've seen to the FFCRA framework. So as many of you are aware, the obligation for covered employers to provide mandatory paid leave expired at the end of 2020. However, employers now those essentially with less than 500 employees nationwide can continue to voluntarily provide leave for any of the FFCRA qualifying reasons and claim a tax credit through September 30th, 2021. So this provides sort of an incentive to continue to offer, all of those qualifying reasons for your employees to take during this pandemic. A quick reminder, though, that this still, unfortunately, it still hasn't been extended to our bigger Sequoia clients. So those with 500 or more employees nationwide still are unable to take advantage of this tax credit. But anyway, let's keep going. And as a few more updates here. So ARPA recently provided a refreshed bank of FFCRA paid sick leave hours effective as of April 1st. So this is pretty important for some of those employers that do want to be generous and continue to offer FFCRA leave voluntarily. Some of those employees that may have exhausted their initial entitlements under the original FFCRA have access to this refreshed bank. And the benefit here is that the employer can still claim a tax credit, even though the employee had exhausted that previous bank available. In addition, ARPA also expanded the reasons for the paid FMLA portion of FFCRA to include all of the reasons that were previously only limited to the paid sick leave portion of FFCRA. So practically what this means is that employees can use the FMLA portion of FFCRA for any qualifying reason under that law. An employer has the benefit of being able to claim a tax credit. The only thing to watch out here for is that there is a difference in the rate and the amount of tax credit available. So, one is paid at a higher rate and the other one is at a little bit of a lower rate. But either way, you still have access to a tax credit for providing that leave. So that really is a benefit. All right. So on the next slide, I want to just point out a few notable, just bring attention to two mandatory paid leave requirements that are both in addition to what you may be already providing to your employees. And just draw a contrast here, how these are mandatory as compared to the FFCRA framework that's now completely voluntary. So California recently revised and expanded their California Supplemental Sick Leave Framework, which now requires employers with at least 26 employees nationwide and at least one in California to provide paid leave for all of these, a whole host of COVID-19 reasons. One of which includes vaccine and leave to recover from vaccine leave effects. So kind of a big deal here in California. This law also has two notable requirements, one of which is a wage statement tracking requirement. So leave balances must appear on that wage statement. Another kind of quirky feature is that this entitlement is retroactive back to January 2021. So practically what this means is that an employee who took leave for any of the California supplemental sick leave reasons after January 1st, 2021 can request from the employer to retroactively apply this new entitlement and replenish any leave type that they may have previously used. So that's something to look out for. You might be seeing some of these requests and that'll require, maybe some pay recoding and just some tracking recoding there involved. And then now briefly talk about New York. So New York is the only state that we know of so far with a separate leave that has just one purpose only, and the purpose is to essentially require employers to provide vaccine leave, for their work site. So it applies to any employer with at least one New York employee, and it's up to 8 hours per vaccine injection. And what I do want to note here is just to remind our clients out there that this is, again, in addition to other paid leave benefits that the employer provides, including some of those that are mandated. So like the newer New York statewide sick leave or safe time leave laws, the statewide quarantine paid sick leave that's available there, and also just your existing policies. All right, so in the interest of time, I'm going to continue on here and just briefly talk to you about some, give you some quick tips on building your policies and also tracking this type of leave because it can get really overwhelming. So, first and foremost, employers really need to have a good handle on the location of their employee population, especially right now where, employers are maybe being a little more flexible and offering teleworking arrangements. You really have to have a good grasp of where everybody is because you want to ensure compliance with any overlapping state or local leave laws that may come into play. In terms of record keeping, so if you have an internal system right now to manage and track your leave, it really should be evaluated just given the influx of new requirements that we are seeing and making sure that it's capable to provide sort of the coding and the tracking that you need in order to essentially show your work, when some of these overlapping leave laws come into play. So this means you should be able to track the reason for the employee's leave, the exact dates, and whether you're applying it against any, special federal, state, or local leave law. The next tip I want to provide you all is that communication is really key here. If the law doesn't have a mandatory notice or posting requirement, it's still best practice to keep your employees informed of any entitlements they may have. This is especially true right now during the pandemic, where a lot of these laws are temporary. You just want to make sure the employees are educated in order for you to not overlook any entitlement that you're required to provide, essentially. Now, in terms of building your internal policy, it's really important to be clear and consistent with applying anything that you have committed to writing. So this includes correspondence, tracking, and any decisions that you make on an employee's leave request. And also just, again, back to the consistency, you really should be treating employees the same in terms of requests that are being granted. So this really does help avoid claims of disparate treatment. All right, and then lastly, quick note here, I know we're running out of time, but I do want to point our clients to some of the great resources we have in HRX to help you manage and think through some of these leave requirements. We have great paid sick leave charts that we develop. They go over and compare all of the core requirements that you may need to consider when building your policy. And for our Sequoia One clients out there, don't forget, you have a great team of HRBPs that are really well-versed and can help you think through a lot of these issues that come up. And for our Sequoia Consulting Group clients, our partnership with Think HR is really a great resource for you to, think through some of this leave administration and policy considerations. So with that, I'm going to move it back off to Joanna to hopefully wrap us up here.
Yeah, so I just wanted to address, we have, I think, about 3 minutes left. So I might be going over by a minute or two. Please feel free to drop if you need to. But in the interest of time, I'm going to just run through a very quick FAQ that we've been getting on vaccines. So most of you out there just want to know, can you offer a vaccine incentive and how can you do that? I'm not really seeing a lot of employers mandating the vaccine, though that is an option if you want to put, certain compliance parameters around that. It is something you could consider. But if you're going to just, try to incentivize it, some tips that I have are basically, number one, stressing that this is voluntary, very important if you're not mandating it. Number two, you want to make sure you're providing good information to your employees so that they know how to obtain the incentive from you. And you also want to probably provide some information about the vaccine so that they can make an informed decision about it. I've linked some information here that's helpful from the CDC. Something else you want to consider from a compliance standpoint is limiting the information that you're receiving in. All that you need is proof that it was obtained. You don't want to take in any medical history information, right? You just don't need it. Just proof that they got it. That's all you need. Keep that confidential. Something else you want to think about is the incentive itself. You want to limit the nature of that incentive, because if you think about it, once that becomes too high and maybe reaches a certain threshold, it starts to look not really so voluntary and maybe a little bit more coercive. So I'm seeing a lot of employers doing de minimis gift cards, de minimis taxable cash amounts. Those tend to look okay. Some other things employers are considering is tying it to a wellness type of program, tying it to their group health plan or employee premiums. That is something you can consider. I would recommend getting direct advice if you're going to do that. We have some wellness program rules that are a bit in flux right now. They're not finalized. So you just want to make sure you're talking that out first. And then another thing you want to consider is you might have some folks that basically are not able to receive the vaccine. They might have a religious exception, a disability, something like that. So you want to think about, what's an alternative for them so that they could still obtain the incentive from you. So some ideas behind that might be allowing them to wear additional PPE, having them do some additional safety training, things like that. Those are all like alternatives that you could consider so that those folks could still gain that incentive from you. And then finally, as Lizette talked about, PTO, that's a great one. You might actually be required to offer it. And there's really very, little compliance concern around offering PTO for these vaccines. So I really do think that's a great way to go. And then I wanted to point out here, we have an amazing COVID-19 vaccine FAQ guide. It is available through Sequoia HRX for all of our clients. It answers your most burning questions as it relates to this. And I apologize we weren't able to do more on the call today, but it's there for you. And then for those of us of you that aren't our clients, we have a public link here available that talks about workplace testing. And so I've just linked it here for anyone to access. But believe it or not, that's the wrap up today. Let's see, I'm right at noon. I can't believe it. I'm just going to really condense everything we talked about today into these 3 things. Number 1, ensure you've taken care of any communications to employees. You want them to understand their benefits, right? That's the most important thing. You want to make sure you're updating your plans as needed and getting those plan amendments done. Number 2, partner with your vendors, your FSA, your COBRA vendor. Ensure you understand any action items you have with them and make sure they have compliant practices. That's so, so important. And then finally, you want to consider any employer policies you might want or need around leave, vaccines, returning to the office. I would be remiss if I didn't, mention our Sequoia Return to Work platform. It is backed by an employer policy engine. So if that's something that you think would help you out, it might be something you want to look into, so you can reach out to your Sequoia rep to learn more about that. Yeah, and that's really it for today. Thank you so much for joining. I'm going to kick it over to Camille to just take us home. Thanks, everyone.
Thank you so much, Joanna, Lizette, Emerald. That was fast and furious and awesome. I just wanted to remind everyone, we did record and we'll be sending you a copy of the recording as well as the slide deck, which has all of the resources and links that the team shared during the webinar, as well as instructions for claiming your HRCI and SHRM credit. As Joanna mentioned, we have a return to work center to help clients approach their return to the office. We're hosting a webinar next Thursday at the same time, 11 a.m., where we'll hear from Roblox and Peloton and how they're approaching their return to work strategy. So tune in for that. We also are hosting weekly return to work roundtables as an opportunity for the community to come together, share learnings, best practices, questions as they make their return to the office. So you can find both of those events at sequoia.com/events. Thank you again to the compliance team. Thank you so much for joining for today's webinar. And with that, I'll let you go. Hope to see you at a webinar here in the near future. Take care.